Your blood report shows MCV and MCH in red, but no one explains what they actually mean together. Most people Google these numbers one by one. Doctors never interpret MCV and MCH in isolation. They read them together as a pattern. MCV tells us the size of red blood cells. It answers a simple question: are the cells normal, small, or large? MCH tells us how much hemoglobin is inside each red blood cell. It reflects how well each cell is filled with hemoglobin. On their own, these numbers don't say much. Together, they form a pattern that points doctors in the right direction. On an actual blood report, MCV and MCH usually sit next to each other. Doctors read them side by side, not separately. One common pattern is low MCV with low MCH. This often suggests a microcytic hypochromic picture. But this is still only a clue, not a diagnosis. Doctors always look at other values and the clinical context. The most important thing to remember is this: doctors look at patterns, not isolated numbers.